concerned because a couple nights ago I was having sex with my boyfriend and our condom broke. So I wanted to get tested for STDs today.
When exactly did that happen?
Saturday night, so like three nights ago now.
And anything different since then? Any symptoms that you felt are different?
No, I feel my normal self.
Any different vaginal discharge or new discharge?
Nope, it's been the same.
Any pain in your belly or the lower part of your belly or cramping?
No, I don't think so. Feels fine.
Any problems going to the bathroom, like burning when you pee?
Nope, that's been fine.
Have you had any pregnancies in the past?
Yes, once before.
And what was the outcome of that pregnancy?
I ended up getting an abortion. I was really young. I was 17 at the time.
And do you remember the first day of your last period?
Yeah, it was last week, so the 5th.
Do you remember how old you were when you first started getting your period?
I think like 11.
And do you normally get regular monthly periods every 30 days or so?
Yeah, I'm on birth control right now, birth control pills right now, so they keep me pretty regular.
Do you feel like your periods are really heavy or really light?
No, I think average, not too bad. They last for like 4 days or so.
Any pain with your periods?
Sometimes I get some cramping on the first day of my period, but I just take like a Motrin and it goes away.
And you mentioned that you're sexually active right now.
Mm-hmm.
How many partners are you currently sexually active with?
Just one, just my boyfriend.
Have you ever had any STDs in the past, like gonorrhea, chlamydia, syphilis, herpes?
Yeah, I had chlamydia when I was 19, I think.
Do you know if your partner has ever been tested for STDs or has ever had STDs?
I mean, we've talked about it briefly once, but I think he said he was fine, but I never like went to the doctor with him.
And that concludes our history taking. So now we will go over how to perform a physical exam in the gynecology clinic, and we will do the breast and pelvic exam. So you have the patient raise their arms above their head like this, and then you start off by examining one breast and uncovering one breast. And you would just visually inspect the breast first. Then you would start palpating from the area of the armpit, and you can either go down in a linear fashion like this, or there are several other techniques, including going in a more circular fashion from outer to inner. You can do whichever type of exam that you prefer. Just don't forget to examine all parts of the breast, and then also examine the nipple. Then you'll examine the contralateral breast, and you would do this exam the exact same way. Next, we will do the pelvic exam. You'll make sure your light is in the right place. You'll uncover the patient. You will take the speculum, and you will put gel on the speculum. And your assistant can help you with this part. First, examine the external genitalia as you're starting the exam. Use one hand to spread the labia open and then insert the speculum. When the speculum is inserted, you can open the speculum. Sometimes if you don't see the cervix on the first try, one trick is that you can close the speculum. You can move it more posteriorly and then you can open again. When the cervix is in full view, then you can perform your pap smear. When you're done performing the pap smear and getting any samples that you need, you can slowly close the speculum and remove it. Next, you'll perform the bimanual exam. The bimanual exam is performed by placing one hand on the patient's pelvic region and 2 fingers inside of the vagina. So let the patient know what you'll be doing. Place one hand on their belly and place 2 fingers into the vaginal area. Find the posterior portion of the cervix, and when you find that, push up, and then you'll actually be able to move the uterus up. And that way you can tell the size and shape of the uterus, and then also when you're pressing on the cervix, at that point you can tell whether they have any cervical motion tenderness. Next, you'll examine the right adnexa. You'll do this by first feeling if there are any masses or if they have any pain. And then you also try to find the ovary, which you can do by placing one hand like this and kind of sliding backward. And you do the same thing on the opposite side. You check to see any tenderness, any masses, and you can try to feel for the ovary by placing your hand like this and moving slowly and sliding it towards you. And that is everything.